Low back pain is one of the most common orthopedic and musculoskeletal injuries that we encounter in physical therapy. And there's a lot of different types of low back pain. Today we're going to talk about non-specific low back pain, the kind that didn't have a mechanism of injury. You can't really tie it back to a specific event, movement, or task that you were doing. It just kind of started out of nowhere. It's lingering around. It's not getting progressively worse, but it's also not getting better. Now, there are more serious types of low back pain. You can have an actual acute incident where you injure your back, or maybe you pull a muscle, or you have a sprain or a strain. We can also have disc-related injuries, whether it's a herniated disc or even a ruptured disc. And then we can have nerve-related issues as well, such as a pinched nerve. All of those types of injuries are going to have a specific mechanism that typically brings them on, and they may have a specific pattern of what you feel with those symptoms. It may not only be localized to the low back, but you may feel symptoms radiating down the leg. You may have numbness, burning, tingling. You may have severe pain or pain that's preventing you from going to work and doing a lot of common activities of daily living. In those instances, it is best practice to seek out formal medical advice. Go to your primary care, go to an orthopedic, go to a neurologist, see a physical therapist if you're able to, and make sure that you have a plan of care that matches up for your needs. But today, we're going to talk about that non-specific, lingering low back pain, and we're going to cover mobility drills. So we're going to go through 3 different tests that you can do to see where you stack up, what you should be able to do, what you're currently able to do, and then how you can get better at that drill. And today, the common theme is there's going to be no twisting involved. In a future video, we'll get into rotational exercises, but today is going to be 3 basic drills and 3 basic tests that we can do to get more flexible, get rid of that nagging low back pain. So one of the easiest tests that you can do at home is just a simple standing toe touch. With this, it's going to look at the flexibility of pretty much the whole back side of our body. So it's not only going to look at the lower back, but it's also going to look at the backs of our hips, our gluteal muscles, and the backs of our legs, our hamstrings. And if we're tight in any one of these 3 areas, it's going to limit our ability to comfortably touch our toes. So for this, have feet about shoulder width apart, how you would normally stand. Have the legs straight, and then you're just going to reach down as far as you can go and see if you can touch your fingertips to the ground. Now, if we're unable to touch the ground, a simple stretch that we can do looks just like the test that we did with one simple modification. We're going to add something in that we can prop either our heels or our toes. And each way, we're going to get a different stretch. Now, I have here a slant board that we can use, but you could just as easily use something at home, like a bath towel or a couple of hand weights to prop the heels or the toes onto. So with this, I'm going to slide back so that my heels are on the slant board, but the balls of my feet are off of them. And then from here, we're going to keep the legs straight. We're going to reach down for the ground and then come all the way back up. If you want to reach for the ceiling on the way up, that's fine as well. But you're going to repeat for a series of 5. Now, having the heels propped up, it's going to put the ankles in a little bit different position. It's actually going to give you a little bit more ankle mobility. So the cool thing about propping the heels, if you have any tightness in your calves, it's going to remove that tightness and you'll feel the stretch more in the back of the leg. Now, we can do the opposite where we can actually prop the toes up. Now, this is actually going to make it a little bit harder. The toes are cocked up, so the ankles are going to be in a more end range position, which means the calves are already starting to get a little bit of a stretch. So when I go to reach down, and I'm going to do the same thing that I was doing before, just reaching down to the ground for 5 repetitions, it's not uncommon to feel actually a little bit more of a stretch in this position, not only behind the legs, but also maybe behind the knee and behind the calf. So what I like to do is start with my feet flat, reach down for the ground, see how far I can go, do a set of 5 with the heels up, a set of 5 with the toes up, then go back to feet flat and see how far we can go down. And you can see now, after just doing 5 reps of each, instead of my fingertips touching the ground, I can actually go all the way down to my fist touching the ground. Now the next test that we're going to do is going to be an active straight leg raise. And this looks predominantly at hamstring flexibility. So for this, you'll lie on the ground. You're gonna have both legs straight, and you're gonna see how high you can lift one leg. And the goal is to be able to get the leg completely vertical. Bring it back down, and then do the same thing on the other side. If we're stiff or if we're sore, you may notice we're not able to lift the leg as high, or the knee starts to bend a little bit. But the goal for this is to be able to get our leg straight up and down, or to get our heel over top of our hip. So if we're struggling with that test and we're not able to get our leg as high as we'd like or as straight as we would like, a simple stretch that we can do involves lying on the ground. And if you're at the gym, you can use a rack set up. If you're at home, you can just use a door frame going in and out of one of your rooms. And for this, we'll have one leg straight up, the other leg straight out. Make sure the toes are pointed up and back, meaning we're not letting them rotate out to the side, or we're not rotating them in. Now the goal for this is to be able to keep the knee straight and eventually slide in as far as we can go. So you'll see a little bit of space between the back of my leg and the rack. As we get more flexible, we should be able to slide a little bit further in and get the back of our leg resting comfortably on the rack. What we can do to make this a little bit more challenging, when we get into this position, we can practice lifting our leg actually off of the rack or off of the door frame. So you can flex the front of your thigh, lift the leg off, let it return, and relax. Try doing a set of 5 of those if just simply letting your leg relax with the back of the leg flat against the rack is too easy. If you're not as flexible yet and you're still working towards it, it may look a little bit more like this, and that's fine. Take 5 deep breaths in and out, spend about 30 seconds in this position, and then switch to the other leg. Now with that stretch, you'll feel a really good stretch going down the back of the leg. Keep in mind though, if we're lying on our back and our leg is straight up in the air, if we hold that position for too long, the blood may come out of the leg a little bit, so you may almost feel like you have a leg that's falling asleep, or kind of that dead leg sensation. So try not to hold the stretch for longer than 30 seconds. You won't do any harm if you do that. You may just start to get some sensations other than the stretching sensation. So the first 2 stretches we talked about and the first 2 tests really focused on the muscles and the tissue on the back side of the body. Now with low back pain, there's a variety of things that can contribute to why you're feeling the way that you are, but the muscles on the front of the thighs and the front of the hips can also play a large role, not only in hip mobility, but how well the low back can move and what you feel in the low back. So another simple stretch that you can do, or a test that you can do, is seeing how well you can bring your heel up to your back pocket. And it just looks like a standing quad stretch. So for this, we should be able to pretty comfortably hold on to something for balance, because I don't want that to be a limiting factor with this test, but we should be able to bring our leg up, hold on to our foot, and comfortably bring our heel to our back pocket without feeling like we need to bend over, without feeling like we need to twist and turn, or having too much space. So an example of what this may look like if you are struggling is you may see somebody trying to reach for the back of their shoe because they're not flexible enough to get that heel all the way up. So this last stretch is for the front of the thigh, and it's predominantly going to be a quadricep stretch, but you may also feel it up into the hip flexors as well. And this is probably one of my favorite stretches, not only for low back pain, but also for knee pain. And with this, we have this rear foot elevated stand that we're gonna use, but at home, you can simply use a chair, a couch, or any object that's roughly this height. And to get into this stretch, we're gonna have one foot behind us, and that's gonna be the stretching leg. The other foot should be out in front of us, and we should be able to get our foot flat. We should have a vertical shin, so we see a nice 90-degree angle at the knee. And then the other component to this is we want to stay up nice and tall. So if you look from the side, I should have a straight line from my shoulder going down the side of my body to my knee. And really what I mean by that is I'm not leaning forward. If you find yourself having a hard time to come all the way up straight because you're getting a really big stretch, simply add another pad underneath of the knee. Now with this, don't worry so much as to how much space you have between your heel and your back pocket. First, focus on being up tall. Then if you can get up tall, you can try to rock back and get that heel towards your back pocket. With this, hold for 30 seconds, stand up, shake the legs out a little bit, and then switch over to the other side. And if you can knock out 2 rounds on each side, you're probably gonna feel about 2 inches taller when you stand up after this stretch, when those hip flexors get good and stretched out. An important thing to remember with this stretch is you need to be comfortable as you're doing the stretch. So having something underneath the knee, whether it's an Airex pad, a pillow, a towel, something soft, so that you're not getting too much pressure on the knee that you're actually kneeling on. Then the other thing that you need to make sure is that we have our back foot on an object that is stable and something that we can comfortably relax into the stretch. And if you do that, you should get a really good stretch on the front part of the thigh that'll complement the other 2 stretches we did for the back side of the thigh. There's a lot of different things that can contribute to low back pain. If you're having significant discomfort, or if you have an exact injury that you can remember how it happened and it's causing more severe symptoms or more severe pain, make sure you reach out to a healthcare provider and figure out what's most appropriate for you. If you're having lingering, nagging, low-level symptoms that are localized to the back, these stretches may be beneficial to help alleviate that discomfort, or at the minimum, make you a little bit more flexible. If you like this video, please share, like, and subscribe, and stay tuned for the next video in the series where we talk about rotational exercises and stretches for the low back.